Maria Holder Diabetes Center.
Eye exams, kidney checks, foot exams, these are all part of whole person diabetes care.
Another 15 diabetic friendly minutes are coming right up on VOB 92.9 FM, all with the compliments of the Barbados Diabetes Foundation. And as June is Men's Health Month, this show is especially for the men. As a man, I would like to know what's happening in today's show. Well, you're a special kind of man, but in today's show,
I wanted Dr. Singh to help us get into a bit more about male erectile dysfunction.
Dr. Diane Bradford is back interviewing Dr. Singh more on male erectile dysfunction. Are you men out there up to hearing more about that? But make sure and stay tuned. And if you're a man who loves to drink, he is not drunk.
When it comes to alcohol consumption, whether we're talking about someone who's living with diabetes or just to the general public,
Dietitian Victoria Cox has some drinking advice for you. All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that's there to help the men and the women achieve their financial dreams. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic, or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
A good Saturday morning, VOB people! Peter Boyce here, a man, contrary to popular belief, presenting a show especially for men and women who love men and want to see them healthy, especially if they are diabetic or pre-diabetic, reminding you about the Maria Holder Diabetes Center located in Warren St. Michael, right behind Eunice Gibson Polyclinic. I passed there up to yesterday. That's the location not only for diabetic services, but even if you like to check to see how things going with your health. Because you know sometimes you'll be feeling good, but health-wise, it's don't be so good. So Father's Day is coming up, so why not treat that special father or father figure in your life to a health check at the Maria Holder Diabetes Center. Write down this number. 417-0305. That's the number to call to make an appointment to surprise that special father or male in your life.
The Maria Holder Diabetes Center.
And like I said, this show is especially for the men, so it's time to hear from Dr. Diane Bradford, aka Dr. D. Men, this one is for you.
Hello, good day to everyone out there. Not forgetting that we're in the month of June, and this is Men's Month. And I'm here again with Dr. Singh, and we're going to continue our conversation from last week. I wanted Dr. Singh to help us get into depth a bit more about male erectile dysfunction. Hi, Dr. Singh, how are you doing?
Hi, I'm doing good.
Can you just tell me a little bit more about erectile dysfunction? Like maybe what is erectile dysfunction? How do you screen for it? How does a patient recognize that they're having it? Because I think sometimes people recognize it probably a little bit too late. Can you just maybe give us more information on it?
Right. So erectile dysfunction is basically the incapability of an individual to initiate an erection for sex, or to maintain the erection to complete a sexual activity. So this is usually recognized first by the patient or by the partner of the patient. Both, they would know this first. It's very important to recognize it initially at the early stage when you know that there is a difficulty or where you have a problem in in your sex life. Most of the times, persons tend to ignore it, or they're not able to accept it that there is a problem in the individual. So earlier you recognize, the better it is, because you would present yourself to your doctor, your physician, and try to actually find out that really do you have a problem with your, do you have a sexual dysfunction, do you have erectile dysfunction or not. So when you go to the doctor, usually it is based on history. So you would give a history that doc, this is my problem, I'm not able to satisfy my partner. So the doctor would ask, like, what is the exact problem? So usually during history taking, we have a screening tool, which is a very important tool, which is known as the International Index for Erectile Function. And this index is of two types. One is a short form, and the other one is a more detailed 15 questionnaire long question. So this is basically focused on 2 or 3, 5 important things. The most important thing is whether you are able to maintain an erection. Do you get an erection? The other one is on orgasm, questions based on whether you can get orgasm, or about your sex life, whether what is your sex drive, how do you feel about your sex drive, are you satisfied, and also about the overall satisfaction, do you feel that you are satisfied with your performance or not. So this questionnaire is basically a screening tool to determine the type of erectile dysfunction. So erectile dysfunction can again be of two types. It is in younger individuals or older individuals. The cause is different, as we discussed last time. In younger, it will be more like a psychological or stress related cause, whereas in elderly individuals it would be more related to a metabolic dysfunction because of any chronic illness. So this tool is very, very important in screening the difference whether this is in a younger individual because of a psychological cause or in an older individual. So each question has around 5 points, and we take the cutoff limit of 22. If you have 22 or above, you don't have erectile dysfunction, and if you have a low score, that is like below 7, then definitely it is a poor score for erectile dysfunction.
Thank you, Dr. Singh and Dr. D, for that special segment, especially for the men, to be continued next week. The next segment coming up is for men who like to drink alcohol. So if you are listening and you are a man that is be saying, I just drink right, but you know how to hold my liquor. Now, boy, you can't tell me that about my drinking. Let's hear what dietitian Victoria Cox has to say about that.
When it comes to alcohol consumption, whether we're talking about someone who's living with diabetes or just to the general public, my response is always going to be less is best. So you don't want to overdo alcohol in any situation. But if we're specifically thinking of persons living with diabetes, then again, not only do you want to have very few drinks, so maybe only indulge in 1 or 2 alcoholic beverages, you want to choose the ones that have less sugar. So trying to avoid mixing drinks with soft drinks or regular soft drinks. You could use a diet drink or soda water or something like coconut water or just plain water, but avoiding soft drinks and juices. I would also suggest trying to stay away from very sugary cocktails, or there are some cocktail type drinks where you can actually order them and ask for the simple syrup or whatever is being used to sweeten it on the side, where you can really control the amount of sugar that ends up in your actual drink. But definitely just trying to lean towards not overindulging in general. And I will say, especially for persons who take insulin, you don't want to drink alcohol on an empty stomach, so make sure you've had a healthy, balanced meal, because it can actually be such that drinking, having some alcoholic beverages in an evening, as I said, especially for those with insulin, can actually lead them to having a low blood sugar by the next morning or in the overnight period. So don't overdo, choose lower sugar options, and make sure you've had a healthy, balanced meal in advance.
We go from Victoria Cox giving you some cautions on drinking rum to our Saturday song of the day. This is an oldie golden soca song, because if you're drinking, you might need to go to Alcoholics Anonymous. This is Bamba with You Got to Be Drunk. Compliments the Maria Holder Diabetes Center and Republic Bank. Or it is not drunk.
Well, it's weekend, no one ain't come out too fat. Time to eat and drink and jump till I get wet. Well, it's weekend, no one ain't come out too fat. Time to eat and drink and jump till I get wet. For the whole
Maria Holder Diabetes Center.
From early, she say for the whole week, I looking to make some money. Now I come out to have some fun, and I begin to party down. You telling me, come, there we go. You don't feel to party no more.
You got to be drunk.
Telling me to leave this party already.
You got to be drunk.
Man, the people swinging and I feel irate.
You got to be drunk.
Whether you are crazy, I cannot tell.
You got to be drunk.
But I know you got to be drunk like hell. Operator, 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 give me alcoholics and
Not only do you want to have very few drinks, so maybe only indulge in 1 or 2 alcoholic beverages, you want to choose the ones that have less sugar.
Alcoholics Anonymous, Alcoholics Anonymous.
So we will now finish off this special edition Maria Holder Diabetes Center main show by hearing from a man, Paul Edwards, on his challenges with diabetes.
I had diabetes since 2009, and it wasn't when I was working permanently in Barbados. It was when I was working in Grand Prix motor racing, where my driver saw me a little bit woozy when I got off of the plane, and he was a diabetic himself, and he tested me and I was 22
Wow.
blood count, so I was well over. So from that moment onwards, I knew I had a problem. I've been a patient of Maria Holder Diabetic Center for probably about 7 years now, since I've lived permanently in Barbados, and I've worked as a chef and in several restaurants in Barbados. But to be fair, I've known Miss Brathwaite, Diane, I've been under her care for this period, and I must tell you that she's been extremely helpful to me and probably saved my toes at least 3 or 4 times in the last few years. From my point of view, I've referred, and Diane has met many of my, probably 2 or 3 colleagues that have had diabetes, and they've also become firm patients of the Maria Holder Center.
In terms of you personally, how did diabetes impact your lifestyle?
Tremendously, tremendously. When I first discovered in 2009, when I told you that, the first situation for me was having a reading of 22, I was referred to a doctor in Melbourne in Australia, and when I came back to Barbados, which is my place of residence, I immediately contacted Dr. Brown, who referred me to the Diabetic Center, to Diane, obviously just straight away. It impacted me in the way of, I was suffering with my feet terribly, high blood pressure always, not listening to Diane Brathwaite always, because she calls me her bad boy, because she just wonders how I survive. But to cut a long story short, I couldn't have done without them. Even when, the going was tough, Diane helped us with some, medicines and made sure that we all got, what we needed to keep going and, to control our diabetes. This facility is top notch. But the long and short of it is, Barbados for many, many years has been known, and sadly, I'm sure that this reputation is getting a lot better. It's always been known as the amputation capital of the world, which is really sad. But with the help of everybody that works at the Diabetic Center, I think we've kind of moved a little bit forward from that now, because you can get help, and I would advise anybody in Barbados who just thinks they may be a diabetic to go to the Diabetic Center. I have nothing but high praise for it.
Cutting-edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time,
Sugary drinks spike your blood sugar faster than anything else. Water is your best friend.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
Holder Diabetes Center.